My name is Dr. Manoj Kumar Sahoo. I work as a gastroenterologist and hepatologist at the Department of Gastroenterology, IMS in Sahoo Hospital, Bhubaneswar, Odisha. Hepatitis basically is inflammation of the liver. It is most commonly caused by viral infection. There are 5 main types of hepatitis viruses referred to as type A, B, C, D and E. The 5 types are of great concern because of the burden of illness and death they cause and the potential for outbreaks and the epidemic spread, and they pose a great challenge, great threat to India. And out of these hepatitis viruses, C and B, hepatitis B and C viruses are of main concern because they cause chronic diseases and they cause liver failure and liver cancer. So out of these 5 viruses like hepatitis A, B, C, D, E, hepatitis A and E are typically caused by ingestion of contaminated water and food. Waterborne outbreaks they happen because of sewage contamination or inadequately treated water. Hepatitis B, C and D are usually transmitted by parenteral contact with infected blood or body fluid from an infected person. The same as the human immunodeficiency virus or HIV virus get transmitted. However, hepatitis B virus is 100 times more infectious and the transmission is faster compared to HIV virus. The common mode of transmission are of these viruses like hepatitis B and C are that include receipt of contaminated blood or blood product, invasive medical procedures using contaminated equipment, sharing needle, sharing razor while shaving, from infected mother to baby during delivery, from the family member to child, and also by sexual contact. The hepatitis B and C viruses can survive outside the body for at least 1 week. During this time, the virus can still cause infection if it enters the body of a person who is not protected. They do not spread by sharing eating utensils, sharing food, sharing fluids during breastfeeding, hugging, holding hands, coughing, sneezing, etc. They are really a global threat. 500 million people are infected with hepatitis B or C, and 46 million people are in India now. So these hepatitis B and C, so they cause annual death of around 1.5 million people in the global scenario. So 1.5 million people that dying because of these 2 viruses. So everybody is very much worried about not contracting HIV or AIDS virus. But if you see the real scenario, this hepatitis and B and C virus, they are having a huge casualty. 1.5 million people that are dying across the world, and in India also. In India, if you see, hepatitis B is the commonest cause of chronic liver disease. It is the commonest cause of chronic hepatitis. It is the commonest cause of fibrosis or cirrhosis of liver, even liver failure, even liver cancer. So the people are dying because of liver disease, because of hepatitis B. So it is a great threat, it is a great concern, not only for India, but also across the world. Viral hepatitis, like the viruses what I told, hepatitis A, B, C, D, E. Hepatitis virus A and E, they cause acute hepatitis where the infection subsides within 6 months. On the contrary, these viruses like hepatitis B and C, they cause chronic infection where the infection persists beyond 6 months. Acute infection occurs with limited or no symptom, may include symptoms such as jaundice, that is yellow discoloration of eye and skin, dark urine, extreme fatigue, nausea, vomiting, abdominal pain, etc. Most persons with acute hepatitis, they usually recover, but a small proportion of people who got infected, they die because of acute hepatitis called fulminant hepatitis. In India, hepatitis E is the commonest cause of acute viral hepatitis or epidemic hepatitis. The second commonest cause is hepatitis B virus. Pregnant women, when they get hepatitis E virus, 25% they die because of this infection. So acute hepatitis usually a self-limited illness, but sometimes it can lead to fulminant hepatitis or acute liver failure, even death. But this hepatitis B and hepatitis C and hepatitis D virus also, they cause chronic hepatitis where the infection, where the inflammation persists beyond 6 months. It persists for many years. And this chronic hepatitis, if they are not treated, if they are not managed properly, they are not diagnosed, they lead to advanced liver scarring called fibrosis or cirrhosis, which is an irreversible condition. Liver cannot be normal, and other complications including liver failure and liver cancer. The question is, how do I know that I have hepatitis B or hepatitis C? The symptom of hepatitis vary a great deal. The large number of people have no symptom at all. Initially, the virus is to be very silent. There won't be any symptom, and sometimes it depends on, like, they manifest with acute viral hepatitis symptom like flu, common cold, general fatigue, joint muscle pain, and loss of appetite, nausea, vomiting, diarrhea, abdominal pain also may happen. They may also have low grade fever. But as the disease progresses into a chronic state, there lead to be destruction inside the liver, inflammation inside the liver which is persistent, and there is to be chronic hepatitis, and further destruction in the liver leads to fibrosis called cirrhosis of liver. If the cirrhosis progresses, the liver disease is to progress, and it lead to complication of cirrhosis like portal hypertension, the upper GI bleed in the form of hematemesis, blood vomiting and passing blood stool. The liver disease can affect the brain, lead to hepatic encephalopathy, and many times it lead to development of jaundice, and rarely it can lead to development of liver cancer.
Yes, sir, one more updation from you. Can viral hepatitis be prevented?
Viral hepatitis can be prevented, as I discussed earlier. Hepatitis A and hepatitis E transmission can be achieved by improvement of sanitation and sewage disposal, measures for water and food safety, and health education on hygiene practices. Safe and effective vaccines are widely available for the prevention of hepatitis A, and even for hepatitis E, it is recently licensed at China. But for hepatitis B, a vaccine is available from 1982. This vaccine has a very outstanding record of safety and effectiveness. It can be administered to any age. Even pregnant women are not a contraindication for vaccination. The protection lasts for at least 20 years, probably lifelong, and there is no need for booster injection. So the protection against the deadly disease can be achieved by receiving a single injection. Single injection means 3 injections we have to take in 6 months period which provides immunity for lifelong against hepatitis B. For hepatitis C, vaccine is not available. Research is on. Prevention of hepatitis C depends on prevention of transmission of the virus inside the body. There is generally no treatment other than the rest and supportive measures to manage the symptom. But for chronic infection like caused by hepatitis B, hepatitis C, and hepatitis D. For hepatitis C, there are effective treatment is available, and many new medicines are in the pipeline, and which can cure hepatitis C. For hepatitis B, both injection like interferon and oral antivirals are available, which can control and many times can cure the hepatitis B infection. For hepatitis D, interferon is available for treatment. So, if the disease is diagnosed very early, it can be effectively treated, and further progression can be prevented, and further complication inside the liver like cirrhosis, liver failure, liver cancer can be prevented, and the disease can be taken care of. So viral hepatitis can be treated if it is diagnosed very early, further progression can be prevented.
Sir, what should hepatitis B and hepatitis C virus infected person be advised to do to protect liver from further harm?
Hepatitis B and hepatitis C positive person should be advised to avoid alcohol and smoking, because it can further accelerate the damage inside the liver disease can progress. Viral hepatitis patients should also check with a health professional before taking any medication, any new prescription, new pill, because many medicines have toxicity to the liver. So that can damage the liver. So they should avoid alcohol, they should avoid smoking, and they should avoid unnecessary medication which can damage the liver further.
Sir, should hepatitis B and hepatitis C infected person be restricted from their working in certain occupational or settings?
Hepatitis B and hepatitis C, as I discussed before, they do not get transmitted by like sharing food, sharing drinks, shaking hands, sitting with close to somebody, talking to somebody, coughing, sneezing, etc. So they should not be discriminated. They should not be excluded to work in their place. Persons should not be excluded from work like school, play, childcare, other setting, etc. because they have hepatitis B or C infection. There is no evidence that this hepatitis B or C transmitted from food handler, teachers or other service providers in the absence of blood-borne contact. If the infected blood or infected fluid is getting parenteral contact to somebody, then the virus can be transmitted. Otherwise, virus does not transmit. So these people should be considered in the mainstream of the society. They should not be discriminated. They should be allowed to work in the society.
Sir, from last question, as you are eminent gastroenterologist and hepatologist, so on behalf of this Liver Health Month and this World Hepatitis Day, what is your role on this prevention of viral hepatitis and hepatitis B and C?
Every year on 28th of July, World Health Organization celebrates World Hepatitis Day. Basically to increase awareness and understanding about viral hepatitis, how viral hepatitis transmission can be prevented, how the people already infected can be taken care of. As a gastroenterologist, my role is to implement the awareness program. My role is to forever I am working in the vicinity. So I have to make people understand, make people aware about the deadly infection which is more deadlier than HIV virus. So one end the virus is a deadly virus which is killing millions of people across the world. Other end a very effective vaccine is available which they have to take once in their lifetime, which can give lifelong protection against the deadly virus. So my job is to create awareness, spread the awareness among the people, among the public, that there is a deadly virus on one end, so which can cause death, even suffering in human being. And other end, a beautiful, safe, effective vaccine is available, and if they are vaccinated, this disease can be prevented in rest of the life. So after creating awareness, my job also includes to increase screening among people, because as I discussed before, initially the virus remains silent, it does not manifest, they used to be asymptomatic. If I can screen people, and the screening we are providing free of cost to everybody, if we can screen people and diagnose the disease at the early stage where the liver is not damaged, the disease can be treated, further progression can be prevented. So my job is to create awareness, spread the message that hepatitis B and C can be prevented, and there is vaccine available for hepatitis B, and there are ways to prevent hepatitis C also. And my job is to diagnose the disease at the early stage so the further progression of the disease can be prevented. And my job also includes to involve in the hepatitis, world hepatitis limelight, to provide the future generation a hepatitis free environment where there is no hepatitis infection in the future, and the future generation can enjoy life without hepatitis infection.
Thank you.
Thank you.